should now be seeing a PowerPoint from me.
Yeah, I can see it. Thank you.
Thank you very much for having me. I'm Sophie Faulkner. I'm an occupational therapist from Greater Manchester Mental Health Trust, and I'm also affiliated with Manchester University. I'm going to talk to you about small-scale qualitative studies and talking generally about designing them using an example from my Masters in Clinical Research. So I'll talk about project design and ethics, conducting the research, the process of actually conducting a qualitative study, and also something about qualitative findings and how they can be used to inform other research. Please be ready to use the chat because I'll ask you a couple of questions. So in terms of project planning and the ethics application, the first stages would be to think about aims suitable for a qualitative study. Now, that could be things such as exploring the experience of a phenomenon or people's perspectives on a particular phenomenon, views of one group on another one, or views of one group on a phenomenon. People talk about things like acceptability within qualitative studies, and some types of studies will look at underlying beliefs, assumptions, and prejudices. There's other types of qualitative research that might look at power dynamics or interactions between people through examining those conversations, and they can look at things like cultures and processes. Sometimes you can have an open question that will change as the project develops, but that's more in specifically perhaps grounded theory and other methodologies. Now, could you possibly use the chat to suggest, if you have in your mind, a good topic for a qualitative study, whilst I go on to the next slide? There's some methodologies that could be more linked to particular types of qualitative questions, but this is by no means hard and fast rules. The particular question could start with these words and for a different one, but there's something around phenomenology, the exploring of a phenomena being particularly linked to experiences. Perspectives is often looked at with thematic analysis. There's a type of analysis called framework analysis, where you can have different groups and be comparing them using kind of a grid and looking at their different views on different topics. Similarly, things to do with underlying beliefs and assumptions can sometimes be looked at with IPA, which isn't the beer, that's interpretive phenomenological analysis, which is the type of methodology I use in the study that I'm going to use as an example today. There's other methods that are listed here which might be linked to certain types of questions, but when you do have a topic and you're looking at what method to use, a good place to start is to look at different studies that have looked at a topic that seems like a similar way of looking at the topic and see what they've used, and then start to look into methods. And another thing I'd say about reading qualitative methods texts is that if you find yourself reading a text about qualitative method and how to do that method that's totally impenetrable and you don't know what it's saying, I would say read another paper, because they vary so much in how understandable they are and how they tell you to do that type of research. So don't think that it's always yourself. Some papers are better written for understandability about qualitative methods. My particular aim was to explore the experience of sleep disturbance in people with schizophrenia spectrum disorders and find out about their perspectives on approaches to improving sleep. And the way that I looked at that was using interpretive phenomenological analysis, and I chose to use individual interviews as opposed to, for instance, focus groups. Other methods of data collection are available. You can use focus groups, you can use surveys to get qualitative data, have free text boxes. People sometimes analyse data from the web. And if someone has a thought about another type of qualitative data that has been or could be used, why don't you type it in the chat now? The sample that I used for my study was people with schizophrenia spectrum disorders, people in secondary care mental health services, because that was the place I'd be thinking of implementing an intervention in future. and they had to have a self-reported problem with sleep initiation, sleep maintenance, sleep timing, or sleep refreshingness. So broadly, kind of people with insomnia or circadian rhythm type problems. What I would say about your sample for a qualitative study is try to make it practical to describe to the people that you're recruiting from when you're setting your inclusion criteria, and think about ease of recruitment. If it's a sample that will be really to access, you've thought about this in advance, and if there's a really complex list of exclusions when you actually approach people to recruit, that can become a barrier. So try to only exclude for reasons that you really do need to exclude someone with that criteria. For me, that was sleep disorder breathing. If it was entirely a sleep problem that was sleep apnea, it wasn't going to be relevant because we were talking about something else. Or if they had parasomnia or just narcolepsy, it was a different thing. So those were really the only exclusions we had. We actually didn't exclude inpatients, which a lot of people do automatically. And I would say consider whether you do need to exclude inpatients, because many times they will have capacity and they will participate in research. We had 15 people in the study, and the application stated 8 to 15. There's no hard and fast rules about numbers for qualitative studies, so it depends on how diverse your population is and what type of topics you're looking at and what method you're using. But it's possible often to allow flexibility in the number, so you could say a range, such that you can stop when the data is saturated, or however you view data saturation, or when you've run out of time, actually, from a practical point. The things that need to happen during ethics application project planning includes thinking about the topic guide and the question schedule, and definitely piloting it, even if you can't pilot it with someone with that condition. So looking at the logic and the order of the questions that you've got, and how they will be phrased, and how the question schedule will be to glance at for the person using it. So really simple things, but you need to try it for real to see that. And creating the participant information sheet, and also thinking about things like data security. Where will things be stored? Is there going to be any paper? Do you need encrypted dictaphones? Are you using transcription, and what's the cost of that? And do you have permission to use transcription in ethics? Because that's not something you want to think of later. And any paper, you need to think about locked storage, although hopefully I suppose we're moving away from paper a little bit now. And this is the time to start thinking about patient-public involvement. There's the definitely go on the Involve website for information about PPI, and consider looking at getting a research design service bursary. Even if you haven't got funding for a study yet, you could be eligible to get a small bursary to pay your contributors, your public patient contributors, to come to focus groups, pay for catering if you were in person, and get that input while you're designing. If you're recruiting patients via the NHS, you would want NHS ethics, or if not, you may want university ethics. If it's staff, it will depend on what you're asking them about, which type of ethics you need, but there's an algorithm available. And the other thing to mention about NHS ethics is not to be too daunted. It can be that NHS ethics is not necessarily longer than university ethics. And there also is such a thing as proportionate review. So if your study is not an intervention study and it's not on too sensitive a topic, it's not thought to be too high risk, you may be eligible for proportionate review. You don't even attend an ethics meeting, they review it, they ask you questions. So it's not a complete barrier. Pro tip to write up your methods section and perhaps your introduction while you're waiting for the ethics to come through. In terms of conducting the research, my experience, kind of day in the life of me when I was conducting this, involved recruiting by going around looking for places to put up posters, attending lots of team meetings. At the time I got advice from the Clinical Research Network, which even if your study isn't an NIHR portfolio study, you could still ask them for advice. They're pretty helpful, I found. They might be able to suggest people that are good to contact or just an approach to use. And there was just lots of time arranging interviews at different locations, doing risk assessments before meeting people. and then reflecting on the interviews and writing field notes and making those refinements to the question schedule later on. And lots of times transcribing and analysing. That's actually the bulk of it. What I found was that people were really keen to be interviewed on this topic. And hopefully when you do your PPI before you go on to be recruiting, you can find out about how people might feel about being asked to talk about this topic and kind of prepare yourself for that, whether they're going to be keen or not, and what you can do about how you phrase it for that reason. And another thing just to mention about is kind of methodology perfection versus reality. So you could be using a methodology which is very iterative, and so you should complete all of your analysis of that data so far before you interview the next person. Now, depending on the situation and depending on the strictness of the methodology you're using, it may or may not be possible to do that. If you have a participant waiting to be interviewed who is eligible and consented and wants to make an appointment with you, whether you can actually analyse everything that came before completely before you meet that next person. And so I kind of met in the middle somewhere where I was completing some analysis of everything before going to the next person, but analysis complete of everything before the next person was just not possible, so that participants wouldn't lose interest and wouldn't have to book something in like 3 months in advance or so on. So it's good to remember that there's some pragmatic options available. I'll say a little bit about coding in qualitative research, because it can seem a little bit mysterious to people until they've done it, and also because it sounds very computerized, or it sounds almost a bit quantitative a lot of the time. My example's in NVivo, but I've got a slide later just saying other analysis programs are available. So this is an example of me coding in NVivo. You've got a data excerpt there, and I've highlighted some of it, and I've coded it to two things. I've coded it to social expectations and self-image, those being two codes that I think that phrase is about. And it really is in a way as simple as that, although it becomes more complex once you've got many codes and many ideas. Different types of codes you could be using. In some methods you might have some a priori nodes or a priori codes, which means a code that you had prior to starting the analysis. Some would describe them also as descriptive codes, and it might be saying what topic they're talking about. And those were some examples you can see there of codes that I already expected to come up, because perhaps I'd asked about that actually in the interview. So you code it according to what topic it's about. Then there's also these analytic codes or emergent codes, and this is things you did not expect to come up, things that have come from the data, and there should definitely be space for things to come from data rather than from what you're originally looking for, in my view. And so here's some examples of things that came out of the data, such as accepting and recalibrating, thinking, is this normal? Using caffeine to counteract medication, the feeling of like searching for a cause, and it would have been wrong to be looking for things to expect like that. So those came as you read it, and things pop out. So other softwares available. Two popular ones are listed there. There are some which are free. I haven't personally used any of them, but if someone knows a good one, that's, especially if it's free or even if it's not free, please write it in the comments now. Some people do use Microsoft Word for coding, and people have done videos about how to do that, although it might be a little bit clunky to do that, but it's definitely possible to do without paid software. And some examples of some themes, a theme here, which emerged from the study, kind of to illustrate what a theme could look like, includes this one about knocking yourself out. And then below that were some sub-themes on that topic. So you can see the different topics that people talked about and how they have all been linked together in the analysis to this idea of knocking yourself out in order to get to sleep, and different ways people spoke about what we're then seeing as in one way one topic. And then here is a slide showing the interrelationship between 4 different themes that were discussed within the data as a whole. And of course, when you present your data and the findings, you will write everything in an order that goes from the start to the finish. But actually, the themes will relate to each other and the codes will relate to each other. And if you're like me, you'll have a large table with lots of post-it notes all over it, and you'll rearrange them for a very long time before you get something like that, and then something where things can go in a certain order. And it's okay for it to go through a stage of feeling very kind of confusing and like ideas are just bubbling up all over the place. But it kind of can be put into an order. And the way to choose the order, I think, is the way that's going to make sense to a reader. This is just a list of the main themes, and on this slide you can see where you can access the paper if you want to read it. But I won't go into the findings because that's not really the purpose of this presentation. Ways to use qualitative findings, which I think is really important. And while I'm talking about this, if anyone has a thought about how would be good to use qualitative findings, please type it into the chat, or what they would like from some qualitative findings. Ways that I think are really good for qualitative findings to be used includes to support large grant applications for other types of projects, and you can use them to inform survey questions. So if you're finding out the prevalence of some views, why not start by starting from scratch with what are the views about this thing. Also can be used to inform trials of existing assessments or interventions. So say we've got a particular intervention and we want to trial it, we might not know exactly what the best way to present this is, or to begin to trial it, or there might be some barriers to trialing it. For instance, people have done work around randomising people to different types of labour control, and before they would do that, they would look into what are the views on this actually. Then also informing intervention development. That ended up being a way that these findings were used to inform developing an intervention to help with those problems with sleep. And also sometimes actually qualitative findings can be used directly inform practice, or directly inform a clinician's understanding of something. Although I think when we're doing qualitative research, we should be cautious that that should not be our only aim, because on average, the amount that clinicians are reading research papers is more limited. So the impact will be bigger if it's through policy and through guidelines changing as a result of the research, I would say. And then that was the PhD project that followed on from that qualitative study, which I'm kind of partway through now. And this is the slide I would leave while I have questions. Thank you all for your attention. I start sharing my screen with you now so that I can see it.
If anyone has got any questions, now's the time to put it into the chat box. I'm not sure if there are any questions, Sophie, but there's certainly a lot of contribution in terms of people sharing ideas and things.
Oh, okay.
Brilliant. Thank you so much for that presentation. That was really, really informative.
Thank you very much for having me.
Lovely.
Shall we send them? Nothing's appearing? Okay. Oh,
brilliant. No, just some positive comments saying thank you. It was really, really useful to see how you've analysed your data and things like that. Thank you so much, Sophie.
Thank you.
So just before Louise Jeffries brings today's event to a close, just to say thank you to everybody for joining us for today's event. An evaluation is going to be sent out to you following on from today, and also a CPD certificate as well. If you'd like more information on how to get involved with the Model of Creative Ability Foundation or with Motion, please see the links. Kerry, would you mind just sharing the last slide, as it's got the websites for both the foundation and also for Motion as well. Oh, brilliant, thank you. So the Model of Creative Ability Foundation UK can also create network opportunities for OTs who are working in similar practice settings if you are a member of the foundation, so there is that opportunity as well. Again, thank you for your attendance and to everyone who's contributed to today's event. Any questions that have been submitted, I think there were a couple that we did miss out that we were unable to answer. We'll collate and then circulate the answers with the supporting documents that are going to be circulated after today's event. I'm now going to hand you over to Louise Jeffries, who's going to bring today's event to a close. So thank you very much for your time, everyone.
Thank you very much, Tori, and thank you, Tori, for really being the driver in organising and organising the event for today. On behalf of the foundation, I'd really like to say thank you to all of our presenters for giving up your time and your expertise. We're absolutely honoured to have Motion and the Royal College of OT and various universities support us for today, and we really, really appreciate that. I have to say, I have been on the edge of my seat all day listening to all of the information and inspiring presentations that we've heard. For me, I think it's really shown how powerful and inspirational this profession can be if we all come together. And I think that's probably the most pertinent thing that I will come away from today with. Overwhelmed, I think Karen mentioned earlier, absolutely overwhelmed that we had 200 people join in with this event today. Absolutely incredible. Charlotte, I particularly want to mention your presentation. Your service evaluation project and your MSc project really brought this to life and really made it real, I think, just to show that practitioners can conduct research in the practice setting. So an enormous thank you from the foundation. Thank you again to all of our members that support us throughout the year. We're planning to host more CPD events in the near future and also a forensic SIG as well fairly shortly. So if any of you on here have got any questions, if you need to know anything about training, if you want to learn anything more about the model, or if you want some support with research, then please email either myself or Tori and we will get back to you as soon as we can. But just a great big thank you to everybody who's contributed today. Thank you.